Remember, the COVID-19 pandemic was more than a health crisis.
The UN system here in Nigeria immediately realized that this COVID-19 outbreak, a global emergency, a pandemic, wasn't only a health pandemic.
It was also a humanitarian crisis, a human rights crisis, an economic crisis, a security crisis. So it therefore required a much more coordinated approach in terms of addressing some of the fragilities and the inequalities that were highlighted as a result of the COVID-19. The ILO, of course, in partnership with other UN agencies, came together to implement a much more responsive and comprehensive plan. And the basis was to make sure that we don't leave anybody behind and we are able to address some of the pertinent issues that came as a result of COVID-19.
The UN COVID response plan was launched immediately after the global outbreak of the COVID-19. There was immediate realization here in Nigeria that the UN can play an important role in helping government and the communities tackle the COVID response.
It was launched at the very early stages of the pandemic. Since then, we work in this joint venture with the European Union. It's a joint approach among different agencies of the United Nations system.
So in terms of impact, the COVID-19 basket fund contributed about 40% of all medical equipment for this country. It was at the forefront, the COVID-19 basket fund managed by the UNDP and on behalf of the UN system, also contributed significantly. For example, outreach, communication, engagement, behavioral change of communities in relation to how to manage the viruses. A lot of influencers were recruited and supported to inform communities in traditional languages, etc. In terms of the socioeconomic side, a lot of cash transfer programs were initiated. UNDP and other agencies injected millions of dollars to make sure that the communities who were significantly impacted in the epicenter areas, especially Lagos, Ogun, Abuja and other parts of the country, had the cash injection they needed to be able to manage the socioeconomic impact of COVID.
What we did with this basket fund, for example, it was critical in providing us the means to transport the vaccines that were purchased to all parts of the country. It also helped us dealing with some challenges that were still there in terms of the management and the equipment of the cold chain. So, as you know, it requires a process on how to manage and keep vaccines at certain temperatures, so this was critical.
And we've seen some progress, or rather impact out of that, because at least for those beneficiaries that we worked with, they also began to see a decline in the number, for example, of occupational or incidences at work.
When COVID came and we were called for this training, what I specialized in was hand sanitizer, which if you see it on the table there is there. And the hand sanitizer, it was something that you can, because of people have not really known how to use and the cost of production, you sell at any amount and people were buying. So it really put money into my pocket as an individual.
During the COVID period, it affected not just me, it affected my staff. But God so good, it didn't eat us thus far because we got the face mask stain that was able to keep us afloat and we keep pushing from there.
We also supported them in the area of social protection, and I think for us it's very, very important, especially because a lot of these women enterprises are operating in the informal economy, and we know that this is the sector of the economy where you have a lot of decent work deficits. So for us to be able to provide support for them to access various kinds of insurances, including health services, access to health services, retirement, and for us those were kind of impactful and meaningful interventions that we implemented from the ILO. Of course, some of them came out of the interventions after our various capacity building interventions with proposals that are bankable. Some of them have able to establish businesses and are now credible employers that that are now actually employing persons in their enterprises.
After the program was when I started my community. I have an online community on Telegram. Right now we are over 700 women in business, startups. I've been able to train over 1,000 for free. I do these things quarterly.
We are starting a training which we are going to train them on leadership skills, social media marketing, how to manage their skills and time, how to brand, and it is for free.
For us, among others, we trained, we built capacity at the primary healthcare facilities, but we also engage in training and capacity building, awareness in teaching hospitals, in other second-level facilities.
I also want to highlight the partnership and the collaboration also with UN Women, for example. In some of the business training that we provided, we also incorporated the element of gender into the program, and it made more sense and it was much more impactful because we are now collaborating, we are bringing the expertise and the competences of the two agencies together to deliver something that is much more impactful and useful.
Okay, so the UN Women basically was all about gender equality, how to mainstream, gender mainstreaming.
They told us that anything we are doing as a company, we should go into our company and introduce gender sensitivity. That is to say, we should think women, we should do women, put women in high positions in our company. If you look at my company today, we have about 3 women to 1 man, which means we have really implemented what they taught us.
Well, the reason why the UN thought this was an important initiative for us to support the government and the communities was we realized this was a global emergency, and the UN as a multilateral organization had both the duty, the responsibility, plus the know-how and the technical capability to support government to respond to this emergency.
I think the biggest lessons is that we can actually deliver as one. Despite having different processes from the agencies, we can actually come together and deliver something that is much more meaningful. And I want to appreciate that this particular intervention, I believe, is actually a biggest story for us to tell on how we were able to position ourselves as UN agencies in order to respond much more effectively and meaningfully during a very difficult period in our lives. And it has also shown us that we are able to complement each other in terms of the areas of work. We are able to build, tap into those competencies and implement something that is much more comprehensive and something that is co-created by the agencies and something that is actually meaningful to those that are receiving the support, especially the beneficiaries.
For us, this is not just about receiving funds, it is about creating a solid partnership with the European Union as well.
We thought the UN system had the capabilities both in helping government to respond to the health outbreak, the health component of COVID-19. Agencies such as UNICEF, WHO, and the UNFPA have a long experience in helping government to respond on health-related challenges. We also thought there was a socio-economic component that this virus and its impact, this pandemic and its impact, will have a significant impact on communities' ability to survive. So we needed to bring the UN system together with all its capacities. So this is the reason why the UN had to get together and bring its all machinery together to be able to help minimize the negative impact of the COVID-19.
It also meant that we are able to tell a coherent story about the interventions because, as you know, many of the beneficiaries actually they are themselves telling the story about the work that they have received, the support, how it has improved their livelihoods. And for us, it's actually a testament of how, you know, delivering as one is very important.
The knowledge I got from the training, we started over because at a point we had to stop and start over again. So now I can say I'm a businesswoman.
And then WHO also helped us with standardization and quality assurance. That alone was top notch because since then, for me, it became a bragging right. Like when I'm advertising my product on social media, I just put it there. Like Our quality is top notch. You can go and check us out with WHO, you know.
I don't think we were able to disseminate, you know, as speedily as possible and as widely as possible the work we were doing and the impact we were achieving. So I think going forward, as we are implementing, the dissemination of that information is very, very important, so that, you know, it will be known, the work that we are doing, the lives that we are touching, and the livelihood that we are improving.